First, I'd like to start today talking about a little bit of my own personal journey with this topic. I began learning and researching about ADHD and alternative treatments about 6 years ago when my son started having difficulties in school and began showing signs of having ADHD himself. We took him to an integrative pediatrician who opposed doing medications and instead suggested giving him high doses of fish oil and gave him tools that could help him when he started feeling overwhelmed in the classroom. He was in a Montessori classroom, he still is, but at that time it was 3, 4, and 5-year-olds in one room. Movement is encouraged and it could get very loud and chaotic, and he had sensory overload and needed help. So at that time this was all really new to me, but I really appreciated the natural approach to his issues instead of just throwing him on medication. And so I started, that began my journey down this holistic healthcare path, which eventually led me here to NTI, and here I am. So as a parent with a child with ADHD, I know firsthand how amazing and bright these kids can be, but also how very challenging it can be to live with them, not only for the child, but for everyone in that child's life. So let's get started. So today we're going to talk about what is ADHD, the statistics involved in the diagnosis in the U.S. today, a brief overview of medications, the theories as to the rise in ADHD diagnosis, and then nutrition therapy for treating it, which would include identifying food allergies and sensitivities, hypoglycemia, and nutritional deficiencies. Then we're going to talk about some alternative therapies and conclusion. So ADHD is a term used for attention deficit hyperactivity disorder. It involves one or all of the following symptoms or signs: hyperactivity beyond the scope of what is considered typical, impulsivity and or difficulty with concentration and attention. Although many children demonstrate these traits at varying degrees, ADHD is diagnosed when it's severe enough to cause significant difficulties in the child's life. So I brought in a video. Here's what I don't know how to do, is start it. Do you think this will work?
Just through your computer?
Yeah. Sorry. I'm going to have to escape though. Maybe we're going to watch a video.
It's loading.
Yeah. Okay. I wonder if I can go back to here. Nope. Shoot. Okay. They're plugged into my computer, but
we're not getting any sound.
Well, it hasn't started yet.
Oh, okay.
Hopefully, we will.
There.
Okay. Just wait here and see if it's going to work. Nope. Can you hear that?
Yeah, just do it that way.
Why do you like school? Because I like to play with them.
Can you guys hear that?
Why not?
The sound is terrible.
How long does it take to your home? A long time or a short time? You have a hard time with your homework? How do you do on tests?
Sorry, the sound was not very good.
Maybe you could just summarize a little bit.
Yeah, and for those of you who want to do a video, you might want to bring your own speakers. So basically the gist is that children with ADHD and learning disabilities often have self-esteem problems, and other kids don't necessarily treat them very well, and they have challenges that the rest of us don't have. So basically be aware of these issues, and like it said, all disabilities are not visible. So we'll move on from there. The video said that 5% of children in the U.S. are diagnosed with ADHD, but according to the Centers for Disease Control, it's 11% of children in the U.S. today, whereas in 1970, it was estimated that 0.2% of children were diagnosed, which is a pretty huge increase. This average increase of 5% per year since 2005, and the prevalence of children ages 4 to 17 taking ADHD medications has increased from 4% in 2007 to 6% in 2011. So this dramatic increase categorizes ADHD as an epidemic. I'd like to touch briefly on medication, the use of pharmaceutical drugs in the treatment of ADHD. The two main categories are stimulants and non-stimulants. Typically, doctors suggest using stimulants because they work well with children, but so ADHD is a neurologically based disorder resulting from a deficiency of a neurotransmitter or a group of neurotransmitters in specific areas of the brain. Neurotransmitters are chemicals that transmit signals between nerve cells and bridge the gaps between them. The key neurotransmitter involved with ADHD is norepinephrine, along with its building blocks dopa and dopamine. The primary medications used to treat ADHD are Ritalin, Adderall, Focalin, and Dexedrine. Medication may be necessary for certain cases, but they can be used in conjunction with alternative therapies. Between 1970 and 2003, there was a 1,600% surge in the use of Ritalin alone. Major pharmaceutical companies have gone to great lengths to market the drugs targeting first children and now increasingly adults, and effectively turning the disorder into a loosely based diagnosis and bringing billions of dollars in revenue every year. Oh, that switched. That went too far. Yeah. Okay. Although a small percentage of children diagnosed with ADHD may need medication to manage symptoms, strict criteria should be followed due to potentially harmful side effects. Common side effects of stimulants may include sleep problems, decreased appetite, delayed growth, headaches, stomach pain, rebound, which is an emotional upswing or downswing when the medication wears off, tics, moodiness, and irritability. More serious side effects include addiction, heart palpitations, and dangerous increase in blood pressure. Consideration should always be given to the following before administering ADHD medication. The child is unable to learn at school. His or her behavior is so difficult that it's affecting their life and their family, or the child is suffering socially and unable to form friendships. At this point, alternative interventions should be applied first, with medication being the last resort. In many cases, dietary changes, the right combination of supplements, and behavioral modification are all that's needed. ADHD is known to be a syndrome of both genetics and environment. However, genetics can only go so far because it takes much longer than 30 years to cause an evolutionary genetic pattern to occur. Therefore, the question must be asked, what has caused this epidemic? There are four schools of thought that potentially answer this. One possibility is that experts have developed better tools to diagnose ADHD symptoms, and that we as a society have changed our perspective. For instance, 50 years ago, a child who was being disruptive in the classroom would just be punished, whereas today, we view that child as needing extra help, therapy, and/or medications. The definition of diagnosing ADHD has expanded to increase the demands due to increased demands on children today. Even at grade school level, many kids may have tons and tons of homework and no recess or no time to relax in the afternoons just to play and be kids. The second theory is directly related to the electronic barrage our kids are exposed to, often straight from birth. Every study performed shows that the more hours a child spends looking at an electronic screen, whether that be television, video game, computer, tablet, smartphone, whatever, the more likely they are to have characteristic ADHD symptoms. Children ages 5 to 16 spend an average of 6 hours per day in front of a screen, compared with only 3 hours in 1995. Also, the typical length of a camera shot has decreased dramatically since television was first invented. Media now jumps from image to image very quickly, which actually makes it addictive. These images affect brain development, the way in which neural connections are formed, and the way children learn to recognize and respond to stimuli. Another possible explanation is the dramatic increase in environmental toxins. From the air we breathe and to the food and water that we consume, numerous toxins are present today that did not exist a century ago. In 2005, the Environmental Working Group did a study. They analyzed umbilical cord of 10 newborn babies. Over 280 different chemicals were found. 217 of those toxins were known toxins to affect the brain and the central nervous system. 208 were known to cause birth defects and abnormal development, and 180 are known to be carcinogenic. Pesticides in our food, lead in our water, pollution in our air, mercury in our fish, BPAs in the plastic that we use every day all have adverse effects on brain development and are known to be linked to ADHD. The fourth theory explaining the increase of ADHD diagnosis is malnutrition in the form of nutrient deficiencies and allergies and sensitivities due to the standard American diet. It comes as no surprise that the food that we eat as Americans harm us in a variety of ways, from diabetes to inflammatory diseases to neurological disruptions such as ADHD. The average American child starts their day with a big bowl of colorful sugary cereal, toast with jelly and juice, or maybe a Pop-Tart. Not only is this nutritionally void breakfast, but many children are reactive to the food colorings and additives in these foods. And beyond this, a high glycemic breakfast like this can cause hyperactivity and inattentiveness, which look an awful lot like ADHD. What children eat has a profound effect on their health and their ability to learn. And research shows that what you feed your body has direct effect on how your brain functions. Diet and nutrition impact cognition, attention, sleep, and mood. Often overlooked, nutrition therapy can be an inexpensive and very effective method for treating ADHD in children and should be implemented into any treatment plan. Approaches to nutrition therapy for ADHD include identifying potential food allergies and sensitivities through lab testing or elimination diets, the avoidance of additives, dyes, and pesticides that are found in conventionally raised produce and meat, as well as prepackaged foods, and addressing deficiencies by adding nutrient-dense food to the diet, especially those shown to improve ADHD symptoms. People are often completely unaware that they have a food sensitivity, especially if it's to a food that they eat every single day, like wheat or dairy products. Everybody is different, so food that may be the culprit for one person may not bother another person at all. A food allergy stimulates a histamine response within the body and generally causes a reaction immediately. These are known as IgE responses and can often be fatal. Food sensitivity, on the other hand, created delayed and more subtle reactions. These can be either IgA or IgG reactions. Food sensitivities can be due to an inability to break down food properly, which in turn will lead to inflammation, gut injury, and a production of neurotransmitters such as opiates. Some of the most common symptoms of food sensitivities in children include diarrhea and or constipation, hyperactivity or lethargy, aches and pains, depression, irritability, aggression, and restlessness. Goodness. Sorry. The most common food sensitivities include those to dairy, gluten and wheat, corn, eggs, nuts, and soy. Children with ADHD and those that fall on the autism spectrum often have either celiac disease or non-celiac gluten sensitivity. That is a condition in which consumption of gluten leads to symptomatic manifestations triggered by the ingestion of gliadin, the main protein in wheat, barley, and rye. In those with either condition, exposure to gluten can result in variable degrees of intestinal damage that can lead to extraintestinal manifestations such as symptoms of behavioral and psychiatric disorders. In 2000, Alessio Fasano and his team at the University of Maryland School of Medicine discovered a protein known as zonulin. Zonulin regulates the tight junctions in the small intestines, either preventing or allowing the passage of macromolecules into the bloodstream. These are often toxins and allergens. Zonulin also helps to regulate the permeability of the blood-brain barrier and can be a factor in other food sensitivities, neurodegeneration, and autoimmune diseases. The removal of gluten has shown to improve mood, focus, and attention, as well as decrease disruptive behavior in children with neuropsychiatric disorders. Food sensitivity tests can be ordered from your physician, as well as celiac tests to see if your child might be sensitive to gluten. However, these tests are notorious for returning false negative results. The best way to test for gluten sensitivity is just to remove it from the diet for 3 months or more and then evaluate symptoms. A large percentage of people diagnosed with ADHD have a deficiency in an enzyme known as DPP4. This enzyme is involved with the breakdown and digestion of dairy products. When DPP4 fails to completely break down casein, the primary protein in dairy, a peptide or a partial protein is formed. These peptides fit into the opiate receptors into the brain and create casomorphins, which function like morphine and can cause serious neurological problems. IgE reactions are also fairly common with dairy, as is lactose intolerance, which is a deficiency of the digestive enzyme lactase. A positive response can be seen anywhere from 3 days to 3 weeks once dairy is removed from the diet. However, due to the casomorphins found in dairy, things may get worse before they get better due to the withdrawal symptoms often seen in drug addiction. Common withdrawal symptoms to look for when eliminating dairy include insomnia, anger, anxiety, hyperactivity, digestive upset, irritability, and cognitive dysfunction. Just keep in mind that these are temporary, they will pass, and like gluten, the elimination of dairy has helped many children overcome symptoms of ADHD. Once you remove gluten and dairy from the diet, if you're not noticing positive effects, it may be time to address other possible food sensitivities. Beyond gluten and dairy, the top reactive foods include eggs, peanuts, soy, and corn. Alternative health providers such as naturopaths, nutrition therapists, and many integrative doctors can perform food sensitivity lab assessments via skin or blood tests to see what foods are reactive for certain individuals. The foods that result in reactions should be eliminated. However, if no IgE reaction occurs, they can often be added back in eventually. The gold standard for figuring out reactive foods, though, remains the elimination diet, which is also the least expensive. As with gluten and dairy, an elimination diet would remove reactive foods for a specific amount of time, typically between 3 to 6 weeks. After this time, slowly add the foods back in one at a time and observe for reactions. Working with a nutrition expert can be very beneficial with this process, as elimination diets can be very stressful for families, especially if the child is a picky eater. One option would be to take out one food at a time and look for reactions, but this may be a little more difficult to pinpoint what you're dealing with. In addition to food sensitivities caused by the food itself, many additives, preservatives, and pesticide residues found in the processed prepackaged foods commonly consumed by children often create reactions that mimic ADHD symptoms. For example, monosodium glutamate, or MSG, is an excitotoxin that can damage or kill brain cells. Aspartame can cause hyperactivity and other behavioral problems by dumping too much phenylalanine into the brain. And pesticides are designed to kill pests, but in humans, they can kill cells, disrupt cellular function, and add toxic burden to the system. When manufacturers test for the safety of pesticides, they never test in children, they never test long-term effects, and they never test the synergistic effects, meaning multiple pesticides at once within the body. A recent study performed by the Cincinnati Children's Hospital concluded that exposure to common pesticides found in our foods increases hyperactivity, impulsivity, and abnormalities in the dopamine system. Artificial dyes like yellow number 5, red number 40, and blue lake number 1 are made from petroleum products. They have been studied for decades to determine their adverse effects on the immune system. And during the past 50 years, the amount of synthetic dyes used in our foods has increased by over 500%. Simultaneously, an alarming rise has occurred in behavioral problems in children, such as hyperactivity, aggression, and ADHD. Avoiding harmful additives and pesticides is as simple as eating whole organic foods when possible and avoiding prepackaged foods. The Environmental Working Group has developed easy-to-follow guidelines known as the Dirty Dozen and the Clean 15 to help consumers inform consumers which fruits and vegetables have the most pesticides and which have the least. Children with ADHD and those on the autism spectrum often have hypoglycemia, which is defined as an inability to control blood sugar balance, resulting in decreased levels of glucose. Symptoms of low blood sugar mimic those of ADHD, such as poor cognitive function, irritability, propensity for tantrums, lethargy, physical weakness, confusion, and an inability to be articulate. Consider the breakfast mentioned earlier of a big bowl of colorful sugary cereal, toast, and juice. As soon as the child begins eating this, a biochemical cascade will begin. Refined carbs like cereal and toast stimulate the pancreas to release high levels of insulin, which cause sugar to empty quickly from the blood into the cells. This will cause a child to crash. Then the adrenal glands will take over, and adrenal glands will then release adrenaline in an attempt to bring the body back to homeostasis. A child with low blood sugar and high levels of adrenaline coursing through its body will be fidgety, moody, and unable to focus. The rate at which sugar from a particular food enters the brain cells and other cells of the body is known as the glycemic index. It is advised that all children, but especially those with ADHD, eat a low glycemic diet. A child on a low glycemic diet often feels better, is happier, and less distracted. The focus should be on proteins, healthy fat, and high fiber foods that satiate and avoid or limit refined grains, high starchy vegetables, high sugar foods, and low fiber foods. Eat several small meals throughout the day to stabilize blood sugar. Now that we know what to avoid in our diets, let's turn the focus on what nutrients can help improve ADHD symptoms. The standard American diet is not only high in sugar and artificial ingredients, but it's often lacking in essential micronutrients. Micronutrients are utilized as cofactors in enzymatic reactions and play a large role in metabolism, neurotransmission, cognitive function, immune function, and detoxification. The following specific nutrients can be incorporated into any ADHD healing protocol. Also, micronutrient tests are available from your practitioner to pinpoint specific deficiencies. One of the most widely researched nutrients for treatment of ADHD is essential fatty acids, especially omega-3 fatty acids. A study done at Purdue University showed that children with low levels of omega-3s, especially DHA, are significantly more likely to be hyperactive, have learning disabilities, and behavior abnormalities. Unfortunately, the standard American diet is almost void of omega-3 fatty acids, and researchers believe that up to 60% of Americans are deficient. The problem often begins before birth due to poor prenatal nutrition, and studies have been done to evaluate the advice given to pregnant women to avoid seafood due to the trace amounts of mercury versus the nutrient deficiencies due to the avoidance of seafood. Low maternal seafood intake during pregnancy was associated with suboptimal outcomes with fine motor skills, communication, and prosocial behavior and social development scores. An analysis by the World Health Organization and the FDA found that the nutrient benefits of eating fish far outweigh those of the toxicological effects of methylmercury. To exacerbate the issue, no infant formulas supply adequate supplies of EPA or DHA. The collective findings from both animal and human studies led researchers to postulate that the deficits of omega-3 fatty acids during critical points of brain development may increase the risk for neurodevelopmental disorders such as ADHD and possibly predispose toward the later appearance of depressive and aggressive behaviors. Omega-3 fatty acids can be found in cold water fish such as salmon, tuna, mackerel, and sardines, pastured animal products like eggs, poultry, grass-fed beef, and grass-fed dairy, and plant sources include flax seeds, chia seeds, walnuts, and certain forms of algae. Supplementation of omega-3s is recommended for children with ADHD with a form of high-quality fish oil that has been filtered for toxins. Cod liver oil is also a great choice as it contains higher levels of DHA and also vitamin A and D. It's also important to maintain balanced ratios of omega-6 to omega-3s to 2 to 1. However, the ratios in this country generally fall around 9 to 1. Omega-6 fatty acids derived from vegetable oils such as canola, corn, and soybeans are inflammatory in nature, especially when heated. It's a good idea to always limit restaurant and takeout food because of the excessive use of vegetable oils by restaurants and the tendency to damage these fats during high cooking conditions. And when cooking at home, use saturated fats like coconut oil and pastured animal products. Zinc is an important cofactor in many reactions. It's involved in the function of over 100 enzymes, has been found to be critical for normal brain functioning. A zinc deficiency is commonly associated with learning disabilities, ADHD, delinquent behaviors, and eating disorders. And a deficiency can be identified by white lines in the fingernails, retarded growth, poor taste and smell, eczema, and poor wound healing. Deficiencies can often be a result of protein deficiencies, diarrhea, and poor chelation of heavy metals. 4 separate studies have shown significant improvements in hyperactivity, impulsivity, and socialization in ADHD patients with zinc supplementation. Zinc is commonly found in many foods, including oysters, grass-fed beef, egg yolks, poultry, and nuts. Phytates found in beans, soy products, and whole grains, though, can decrease absorption, so it's a good idea to limit these. Because zinc is so prevalent in the American diet, deficiencies are rare, but children with ADHD are often found to have low levels when tested. And it's always a good idea to test, but zinc can be safely supplemented at a dose of 20 to 40 milligrams without testing. Magnesium is helpful for energy production and aids with muscle relaxation, sleep, anxiety, and depression. A deficiency of this important mineral is characterized by fidgeting, anxious restlessness, psychomotor instability, and learning difficulties. There aren't many studies on the effects of using magnesium for ADHD treatment, but there is evidence that children with ADHD are deficient. An increase in magnesium through diet and/or supplementation may improve hyperactivity and inattention, and it may also improve sleep quality, digestion, and anxiety. Magnesium is found in beans, nuts, whole grains, and green vegetables. However, soil depletion and modern farming practices using potassium and phosphorus-laden fertilizers alter the plant's ability to uptake magnesium, and boiling, steaming, and broiling also further alter magnesium. So therefore, it may be necessary to supplement. On average, 2.5 to 4.5 milligrams per pound of body weight is sufficient, and for best absorption, smaller doses taken throughout the day is ideal. You can also get magnesium through your skin through Epsom salt baths. Research shows that iron deficiency correlates with the presence of ADHD and with the severity of symptoms. More than one study has shown that symptoms improve when iron deficiency is treated, and at least 16 research studies performed around the globe concluded that infants with an iron deficiency anemia had reduced cognitive, motor, and/or social emotional functioning, and older children displayed difficulties with learning and behavior. Red meat is the most bioavailable source of iron, followed by poultry and fish. Spinach and leafy greens contain iron, but it's poorly absorbed by the body. Improving your digestion is the best way to increase iron absorption. Dietary replenishment is preferable over supplementation because iron can often have potential toxicities and side effects when supplemented. If one suspects that they or their child have an iron deficiency, always get tested first before supplementing. Children with ADHD are commonly deficient in vitamin D, and several studies have shown a correlation with low levels and symptoms such as mood disorders, anxiety, and inflammation. 2 different studies performed in Qatar showed that improved symptoms of inattentiveness when engaging in leisurely activities outdoors versus indoors in a windowless room. And improvements were observed in irritability, hyperactivity, social withdrawal, and cognitive awareness after 4 months of supplementation. Vitamin D can be manufactured in humans via sunlight. However, in northern latitudes and in places with extreme climates, it may be a good idea to supplement. The tolerable upper intake levels for children 4 to 8 is 3,000 IUs per day, and for children 9 and above is 4,000 IUs per day. Vitamin D is also available in the diet through animal fats such as butter, dairy, beef, lamb, and lard, and cod liver oil is an excellent source. Digestive enzymes help to break down food particles for better digestion and better absorption. They can help reduce gas, bloating, constipation, and diarrhea. And they can also help to prevent the development of new food sensitivities by breaking down inflammatory proteins. Additionally, they can reduce inflammation and leaky gut by breaking down foods properly to avoid feeding yeast and bad bacteria. The most common digestive enzymes are protease to break down proteins, lipase to break down fats, and amylase to break down carbohydrates. And these can be taken separately, or you can get a complex form that has all 3. And it's preferable that these should be taken on an empty stomach before each meal. Humans have 100 trillion microbes in the intestinal tract that make up the gut microbiome. A healthy gut microbiome is essential for intestinal health, immunity, and nervous system function. There's mounting evidence that gut bacteria can modulate mood and behavior via the gut-brain axis. And a long-term study performed in Finland suggests that probiotic supplements beginning in infancy may reduce the risk of the development of neuropsychiatric disorders such as ADHD later in life. Probiotics are commonly found in yogurt and fermented foods such as kombucha, sauerkraut, and kefir, and should be eaten regularly. Probiotics can also be supplemented. Look for products with multiple strains and change brands regularly. In addition to nutrition therapy, there are many other holistic treatments for ADHD that do not involve medication. Exercise is an easy, obvious choice for kids with excess energy. Exercise not only increases blood flow to the brain, but it increases serotonin availability to help quell hyperactivity. Biofeedback is a way to train the brain via real-time feedback about brainwave activity through electronic instrumentation. A person can learn to control their brainwave activity and use that information as a tool to refocus and slow the brain during bouts of hyperactivity and anxiety and help to improve concentration. There are devices now that you can buy inexpensively online for home use. Inner Balance is one that you can buy that it has a sensor that plugs into your ear, and then you plug it into your smartphone, and there's an app. And the screen offers a variety of adjustable breathing monitors. I put a picture up here. So I actually have this at home, and I brought it in case anybody wants to check it out. But this is 2 different screens. The left screen is the breathing monitor, and it kind of like goes in and out like this, and it's very relaxing to watch. And you want to keep the edge in the green. If it's in the red, you're not focusing. And then the right screen, that is your stats. It tells you how you're doing. And so again, I have it with me if anybody wants to check it out. Energy therapy relies on the theory that energy blockages or imbalances in the body are either a cause or effect of disease, and that by rebalancing or unblocking the energy, we can bring about healing. This healing can come in many forms, such as Qigong, therapeutic touch, Reiki, and polarity therapy, just to name a few. And Chinese medicine takes a similar approach by getting stuck qi or energy moving through acupuncture, herbs, and body movements. There are no formal studies to the effects of these treatments, but they've been used for centuries, and people can attest to their effectiveness. Consistent behavioral modification by parents of children with ADHD is every bit as important as nutrition, supplementation, and medication. There are many different approaches to behavioral modification for hyperactive and inattentive children, and no one method will be right for every child. However, there are some general guidelines that will work well with every child with ADHD. First, put yourself in the shoes of a child with ADHD. These kids are subject to a constant barrage of negative feedback from everyone around them, from their parents to their peers, to their teachers, to perfect strangers. It's absolutely imperative that parents make great efforts to encourage their child's strengths and promote a healthy sense of self-esteem, self-confidence, and self-worth. This will be the psychological and emotional foundation for these kids to be successful in life. Make sure that the child is doing something that he or she enjoys every single day, and do not allow difficult academics to rule the child's free time. Control and limit the amount of time spent watching TV as well as the content or any electronic device for that matter. And encourage social relationships and athletics that the child is interested in. Sleep is crucial. Make sure that a child with behavioral issues is getting adequate sleep every single night. Often children with ADHD have trouble falling asleep due to increased brainwave activity, and some options are valerian roots, chamomile tea, magnesium glycinate, or supplemental melatonin. These can help calm the brain and induce sleep. Also, a regular bedtime routine that consists of low light, quiet reading, or soft music can be helpful. If you or someone you know is suffering from ADHD, it's good to know that there are numerous treatment options out there other than medication. It may take several different approaches before you find the right one, but stick with it. Take a good look in your pantry and in your refrigerator. How many products do you have that contain harmful ingredients such as food dyes or preservatives? Start swapping those out for healthier choices. Read labels. This is the most important thing. Arm yourself with education and be informed about what you're feeding your family. Consider getting your child tested for food allergies and or sensitivities, or commit to an elimination diet. Avoid the foods that may be causing problems. You can start today by eliminating gluten or dairy. Add nutrient-dense foods to your child's diet and consider micronutrient testing to rule out deficiencies. It may be beneficial to work with the nutrition therapist during this process. Through nutrition, exercise, and lifestyle changes, ADHD can often be managed long-term without medication and their harmful side effects. Raising children with ADHD can be a most difficult task, but by arming yourself with education and patience, the rewards can be exponential. And always, always remember that your child is unique and amazing. And I'm done. Anybody have any questions, comments, concerns? Yes.
So you started out by telling us about your son.
Mm-hmm.
Have you tried some of these things with him?
I have tried pretty much all of these things with him. I will admit I haven't been super duper strict with the nutrition, ironically.
It's hard.
It's so hard. It's so hard. I mean, I have cut it all out of our home, but going out to birthday parties or friends' houses to spend the night or whatever, I can't control those situations, and he's not going to control that situation himself. So that's been a little bit difficult, but I've definitely done my research on supplements and used those. And like I said, my home is very clean nutritionally. And we've done acupuncture, we've done biofeedback, we've done, what else? I don't know, a lot of stuff.
What would you say that's really worked as a parent, from a parent's
Yeah. Well, I think the nutrition is key. Definitely. I think that works. And he's 12 now. This all started when he was 5. He will even tell me, oh, I had too much bread today, or whatever, and I don't feel good. Yeah. And he definitely has hypoglycemia in a big, big way. So every day after school, we kind of battle. And then I say, I really think you need to eat. I'm not hungry. And then he eats, and then he comes back. I'm really sorry, Mom. I was hungry. So, and that's daily. So, acupuncture has worked. Well, we had one practitioner that worked I thought, really well, as long as we saw her consistently. And then we had another practitioner that I feel like, this was just recently, I don't know if she just opened up something, but everything kind of reverted back, and that was not so great. So that's been hit or miss. Yeah.
Have you tried, you said you had the biofeedback?
I do,
monitor.
yes.
Have you tried that with him?
I do, yeah. That's the reason I bought it, was for him. And it does work, but getting him to actually do it is challenging because he doesn't want to. And, you know, he'll tell me that it doesn't work, but it does. Because it's basically meditation. It's just guided meditation. So, and then if you do it, if you're interested, or, you know, he's not a competitive person at all, but you can, you know, it'll give you like, way to go, you know, it'll remind you, and, you know, it gives you perks, but he doesn't care. So, yeah.
Thanks.
Yeah.
Did you run across anything in the literature, your own journey, about detoxing kids?
I have, in my research, especially with autistic kids, that's a huge, huge thing. I have not personally done it, but yeah, I mean, I know that especially with kids on the autism spectrum, their detox systems don't work as well, especially methylation and chelation. So that is a big issue with autistic kids, which I'm sure would roll over into ADHD as well, but I haven't done it myself. Yeah. Mm-hmm.
Have you tried other forms of magnesium besides the glycinate? Or
The
is that
glycinate?
the one that works best for you?
I think that one works best for sleep. I think, I can't at the very minute remember all the different kinds, but is it aspartate? Citrate?
Yeah.
Yeah, I know I have it written down somewhere. One works better for digestion, one works better for sleep, and glycinate I find works better for sleep. I actually give him magnesium in the mornings before school, and there's a supplement called Calm Zen. I can't remember who makes it, but I get it on either Emerson or Partners, and it has GABA, theanine, L-theanine, and magnesium in it, and I think that works really well. Yeah. So I took one this morning. But yeah, and I haven't done any kind of like adrenal anything with him at all. But he does have very big emotional ups and downs, which is his biggest challenge. So, and he's very smart, but he has problems at school.
From what I understand, ADHD is a lot more common in boys than girls.
Yeah.
And I wondered if you came across anything
As to why?
Why that is.
Not necessarily to explain why that is, but I think that boys just inherently are more active and hyper, just as a species, and that they therefore are targeted more for ADHD than girls are. But I think often girls, it shows up in a different kind of form, maybe more ADD than ADHD, whereas they kind of zone out and can't focus, but don't have that hyper component that everyone around them finds so frustrating. So, but no, I don't know that there's a scientific reason that boys are more heavily diagnosed. Anybody else? Okay. Well, thanks for bearing with me. I'm not the best presenter.